Good morning, everyone. This is Rachel Burgess-Burnett, Deputy Commissioner here at Children's Services Division.
And this is Tiffany Junkins, Manager of Children's Services Division.
And Tom Moes, Program Development Coordinator with DFSS, helping with technical assistance today.
So good morning, everyone. We apologize for the delay. We've got some new equipment here in the room that we're using, and we all needed to acclimate ourselves and get it up and going. So we thank Tom for his patience in working with us and getting this done this morning. So we're going to go ahead and get started. Again, thanks for being with us. I see that there's about 121 people that have signed on. And so again, everybody's on mute right now, but please, if you have questions, we will want you to put them into the chat. If we're experiencing technical difficulties on your side, please let us know. But we're here and we're very happy to be with you today, Thursday, July 23rd. And so we're going to walk through some slides, and we'll do the same thing we've done the last couple of meetings that we've had, is give you an opportunity to talk to us. But one of the things I wanted to start with today, and you know, we are all very, very busy doing work here and what you're doing out in community, but I wanted to share a message with you this morning. I was on the phone this morning with our regional office and Kathy Gray, who's our regional person, and she wanted me to give you a message. And that message is, first, thank you for what you're doing. But she also wanted to make a point of saying to all of you, and from her lens, because she has a family member who has a child in one of our child care centers. And she said, you know, the work, she wanted to make sure that everybody understood. She understood how hard it was and how heavy a lift it is to do everything that you were doing to provide health and safety environments. But what she wanted you to know is her 4-year-old family member is able to talk about sanitizing, the need for washing hands, stay away 6 feet. And so the messages are resonating with our children, as we've talked about before. But from the regional office, what she wanted to say to the city of Chicago is that, you know, your hard work is paying off. And she knows that you put in great systems, and, you know, it's difficult as far as trying to do everything you're doing with things changing as consistently as they have, as we've had to respond to COVID-19. But she wanted to acknowledge the fact that we are doing exactly what we said we wanted to do, which was provide the best health and safe environment that we could for our children and families. So on her behalf, I wanted to share that with you. And I wanted to, on her behalf, to thank you for everything that you're doing. So let's go ahead and go into.
Before we proceed, I'm just going to ask if we can do a sound check. Can you let me know if you hear us? Can you go ahead and type into the chat, yes? Okay, great. Thank you so much. We appreciate that.
Thanks, everyone. So we're going to go ahead and move into our slides really quickly. And so what we have here is really our agenda. Again, we're going to start with the update, as we always do, making sure that we recognize that we are still in the midst of COVID-19 here in Chicago. A little bit again on reopening, move through, you know, ISBE, CSD Spotlight. And so we're going to move through these and then give you an opportunity to talk to us. Go ahead. So, you know, again, 165,301 positive confirmed cases in Illinois. This is not Chicago data. This is Illinois. And, you know, that sad piece of news in the middle there, 7,347 people have lost their lives to COVID-19. There's a lot of tests that's been performed, and we're really happy to see that we are able to get testing out in community. One of the questions that I am going to ask later, and I just want you to think about it, for those of you who've had any positive cases where your staff or family members have had to go and be tested, I am going to ask you about the timing on that, because I'm going to have a meeting later, and I just want to see if getting testing is working and how long is it taking to get some of the responses for the test results. And so hold on to that nugget. We're going to come back to it. But again, our testing is up in Illinois, which is a great thing. In many of our communities, there were testing centers that were put in because we knew some of the communities were hardest hit. Next slide. And so as of today, we've reopened 196% of our sites, or about 98% of our sites are open. And so we know, you know, it's a heavy lift to do it, but we want to thank you. We've been able to get families into centers, into classrooms, but what we also are doing is we're continuing to serve children remotely. And so the next 2 points here, we still need you to document your classroom attendance in COPA. We can see that the attendance is climbing, and that's a great thing, meaning children are in those classrooms exactly where we want them to be, and families who need it to be inside with their children in care are able to go back to work and do the things that they needed to do. But two things we need you to do is we need you to continue to put your attendance in COPA, because we are trying to keep up with attendance to see how we're doing out there. But we also need you to be reporting on the children that you're serving remotely. And so we are asking our supervisors again, and I have Jocelyn Buchanan, who's my assistant, reaching out as well, because we need to get the number and capture the number of children as being served remote. So we'll continue to do that, and there'll be continued asks of all of you so that we can keep those numbers going. Next slide. And so we know, and this is one that we had up there before, yes, we're staggered reopening, and I say that because we have some agencies that are going to come up next month, meaning the first part of August. In order for them to get everything that they needed to get themselves open, they needed a little bit more time, so they're coming online in August. And we are acknowledging that. We've worked with our funders around that. We know that this is what we've needed to do to be safe in our community. And so we've been working with you, and we hope that, you know, everything that you've needed, you've been able to do. But my reminder here is, remember, that's what we're here for if there's some assistance that you need on our part. Community impact has been one of the reasons, staff availability, and also your family response. We understand that families are still a little nervous about putting their children in center-based care. And we're hoping that some of the work that we're going to be doing, and Tiffany will talk about it with some of the spotlights, we'll get some information out there that will let parents know that things are happening, that children are safe, your environments are working, all of the health and safety precautions that you're putting in place are working to keep children and families safe. And we have to continue to reiterate that for our families. And so, again, just reminding ourselves and reminding you that we're still in reopening phase. We know some of you have now been open for about 4 weeks, and we'll begin to increase your classroom capacities. And we need you to be letting us know that as well as you're increasing your numbers. When you go from 10 to 15, we need to know from that number to that number when, so that we can keep our records straight on how many children are being served in community. Next slide. So again, I'm just repeating myself, and I know you've seen it and you've heard it, but it begs for us to do it again. It's about the reopening plans, making sure that we have them, making sure that your DCFS licensing rep has approved them. Again, they're their approval, not us, but we're looking at them to make sure that we can witness and see health and safety precautions and how you are planning from the door of entry for your families, making sure that you understand that we're not doing family-style meal service right now, that individual meals are being provided. So we're looking at those kinds of things that we know mitigate risk in this particular environment when we're looking at it. But DCFS needs to have that in their hands, and they're the approver and can say, yes, you are able to reopen, and also that, yes, you can go ahead and increase your classroom sizes. So again, it's giving us the data when you're reopening. We need to know, again, the ages and the groups and the number of children in each that you're planning to reopen. We have to keep our records consistent so that we're able to make this information reportable both to HHS and also to the mayor's office. You've got to determine what plan you have in place for children who are remote. So thinking internally, if you've got teachers in classroom with children, who are the individuals on your staff that's still connecting with parents whose children are still at home for remote access? We just need to know that those things are still continuing and that children are still connected to you, families are still connected to you through this process. So one of the things, and we said we're working on our COPA enhancement to make sure that you're able to put temperature checks in and that you'll be able to record children that are receiving remote services. We're hoping that this is going to go live very soon so that you will be able to go into the system. We will do PowerPoint with some information on the how-to so that information will be out there for you as we continue to go through this. So that's also still coming. Just wanted you to know it is still, we're still working with it. We had to move to the universal application, getting it up and out because of the dates, the timing of that. So trying to do both didn't work. So we have moved forward with the application. We're in placement. Tiffany will talk about that in a little bit, but just know that we're going to get this up and out very soon to you as well. And so I'm turning it over to Tiffany so she can talk about what I just mentioned. Boy, wasn't that perfect.
You know, Saratha was right there on cue. So as Saratha had mentioned, we do plan on making those COPA enhancements. Just understand that the same team that we have that works on applications and placement, they're the same teams that we also need to make it happen as far as the COPA enhancements. And so we had to make sure that we kind of put one before the other and making sure that we can get our live placements out there. So I'm excited about this information that we're able to share today because we had live placements last night. They occurred July 22nd, and 99% of our sites were prepared for placements, which means that you set up your slot matrices in COPA and you were ready. And so I just want to, say hats off to you. Thank you. When we reached out, you guys were very responsive, and so I definitely appreciate that. So our results. We were able to tell with your help in flagging the children, the returning children, that we were going to have 4,984 returning children. Based on that, that left us with slot availability of 3,478. Those two numbers combined is what equals our total preschool slots. Of course, that's PFA, and that's also Head Start. So those combined are the slots that we're able to offer. So offer letters did start to go out last night to families, and so for families who selected you as their first choice, and they're excited about coming to your program, just make sure that you're communicating with your staff that they should be expecting to, start receive calls from families, because a part of the documentation that went out really told them that they need to contact the Community Early Learning Program and set appointments to make sure that they're not doing pop-ups at your facilities. We really want this to be a structured approach, understanding the health and safety risks that are concerned. And that way you can work with parents one-on-one in terms of how do you want to go ahead and verify and complete enrollment information for the new school year. In addition to that, one of the things I'm going to be asking, and it is a heavy lift, but we do expect this to happen naturally, but I want to make sure that we're saying it, is that you have to manage your slot matrix, right? So there's ongoing maintenance that's going to be required. It's not a one-shot deal. And so when there's changes within your program, if you know children have left or are going to leave, then you need to make adjustments in the system to make sure that we can be accountable for the number of seats that are actually available. Having live information that lets us know how many offers we can make, it makes everything a lot smoother. It makes, what we're able to do for families a lot smoother as well, and not putting them in limbo and offering them a seat that doesn't actually exist. So we definitely need your help in making sure that we're maintaining and managing our slot matrix.
So you received before, and I just want to make sure that everyone has a copy of the new rules for 407, which is our child care licensing, making sure that you have that and understand that it was on file for a maximum of 150 days, which means that projection is once we get further into COVID-19, if there's something, again, that changes, then the rule was left open to allow for those additional changes to be made. So our responsibility here and your responsibility is to keep up with the new licensing rules as they change so that you can ensure that you are following the guidance and doing what it is that is required by DCFS. The Restore Illinois Daycare Guidance, again, this is just a link. It's in there for you so that you're able to go and see what information is out there from the state of Illinois on child care reopening and all of the safety precautions and guidelines that we are being asked to make sure we have in place. And so reopening, again, and we talked about it and we'll talk about it again, and yes, we have had some positive cases that have been reported, and you are required to make sure that you are reporting any positive case, both to DCFS, your licensing representative, Chicago Department of Public Health, and also to us here at Department of Family and Support Services. You've got to report a staff member of a child who have come in contact with the person. The purpose in that, again, and we talked about it before, really is about contact tracing and our ability to see where there might be community spread so that we know more of what we need to do. But then the guidance that you receive based on your report about closing a classroom, closing a site, the number of days. All of those things are the pieces of guidance that's being given to you as a result of your reporting any of the positive cases. So yes, we have had positive cases. We do know that the numbers of positivity rate has ticked up a little bit here in Illinois and in Chicago, and so we're trying to keep our eyes on it. But we are also, again, I'm just putting this up there again to state you have to let us know if you have any positive cases in any of your sites, because we have to have this information for our records, and we have to be able to respond if there's any questions. And so there should be no hesitancy on your part about letting us know about any positive cases that you're experiencing. And so I did put a question out there, and I can see that a few people have answered, because one of the concerns is if there's a positive case and you're telling staff to go out, or if families are going out for testing, what kind of time frames are we experiencing as far as getting test results? And I do see one result if they're saying that the test result has been coming back in 3 to 7 days, and which is, you know, still one of the things that we know is that trying to get that in time so that you can make a decision. But one of the things you're saying, I know, to staff or families is you can't return until we know that you have a test, and you can't come back until after the number of days that are required. And so we know that we've heard about some testing that has taken some time, but I just wanted to just see for what you're going through and what you're witnessing. So when I'm in the meeting that I will be in talking about what's happening, that I'll have some information. Can you scroll up a little bit, Tom, to see if there's any other time frames that anyone's offered? And if you haven't, if you have any information to share on this one, it would be a good time for you to put it in there. Okay, Jennifer, are you, anybody, again, I hear somebody again saying that they weren't able to hear. I want to make sure that people are able to hear. Thank you. Thanks for responding. All right, so we're going to continue. And so Walgreens has a 1-day turnaround. That's great to know.
That is great.
That's great to know. Thanks for sharing that.
Yeah, I heard CVS too.
CVS and Walgreens.
They're also accepting COVID. They're doing COVID-19 testing by appointment.
Okay.
Only at select locations.
Great. Okay. Well, thank you. If anyone else has anything, we just want to capture it so that we have some information that we can share as we're continuing to talk about how this is working in Chicago. So I thank you for what you've provided. We'll go on to the next slide. Thanks, Tom. And so again, this is just reiterating what we just talked about, and that's the reporting. And then, you know, if you're closing a classroom, when you report to us, let us know if you're closing a classroom. Let us know if you're closing a site. Let us know the number of children that were in that classroom. If it's a classroom, we need that detailed information for our reporting. And so again, reference back to this so that you can make sure that when it is being reported, and I know one of the teams were putting a document together to send out to you to help with that, as far as making sure that you're covering all the bullets as well. But you got to then, whatever you do, once you call in and you report it, you got to follow the guidance and direction. And so if CDC is saying you must close for 14 days, you must close for 14 days. And I want to say that to you because, again, this is public information. And if you don't close and someone says, well, it was my understanding that they had a positive case and they didn't close, you're putting your license in jeopardy. And so, again, this is about health and safety. This is about keeping all of the children, families, yourself, and your staff healthy. And so please follow the guidance and the direction that you're being given to make sure that you are able to clean the room, clean the facility, and do everything that you need to provide that safety and healthy environment for yourself. Next slide. And so again, we can't overstate the need for enhanced procedures as far as cleaning. Anytime there's anything positive or anything going on as far as, you know, we are also in flu season. You know, we've got everything going on at the same time and other kinds of viruses going on. And so I can't, you know, overstate the importance of the enhanced cleaning in your facilities. Constantly making sure that at the end of the day, before you reopen a classroom the next day, that the detail that is being done is done in every one of your spaces. We just cannot, we're doing it at home. We got to do it in our centers. We got to do it in our cars. We got to do it in our office environments. This is where we're living right now. This is our new normal. Is the need to continue to clean our environments, and we just can't overstate the requirement and what we need to do. Again, and I just want to say again, because I did get a question from someone about soft toys, and this is not the time for soft toys that cannot be cleaned at the end of a day or in a classroom. And so we're saying no to those items because you can't protect nor clean those during the day. And so you've got to use items where you can sanitize safely, wipe down, disinfect safely, and make sure that you can do that so that there's no shared usage of toys. And infant rooms, making sure that you have baskets where, you know, 2 children are sharing the same. I mean, it's increase, 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 enhance, 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 and we can't say it enough. Again, that we know what we need to do with PPE. We've got to wear our masks. We've got to make sure that children have them. And to that point, I'm just going to say, there are still some children masks here at 1615 Chicago Avenue that have not been picked up. And I'm going to say this, and I'm not saying that you don't need them, but if they're not picked up, and I get someone who is saying that they need more, I don't want to give them up. I want first to make sure that they go to who they need to go to, but they're not helping anyone sitting here at 1615. So if you have not picked up your child mask, we need you to do so. And go to the next slide. I think that's where, if I organize this well, go to the next slide. Okay, my organization and 15 different things working at the same time this morning, not so much. But here is the person who you can contact. Jocelyn Buchanan can work with you to get an appointment to come and pick up your mask. She's able, we have them, they're all organized by agency. All it takes is for her to know who's coming and when, so that these masks can be picked up. But after a certain amount of time versus them sitting in a space and not being used, we're going to want to get these off of our hands. And so I'm going to keep minding it right now for the next week to see if all the masks are picked up, and then we're going to have to make some decisions about this donation. They were donated so that children can use them, and we need to get these out and in your hands. So we're going to follow up again. I know she's been following up with individuals. There was someone who picked up today, so I know you're working on it. But we're going to give it another week or so, and if they're still sitting here, we've got to make another determination because this donation came to us, and they want to know that they're out in children's hands, and so we need to do that. And so our next webinar, and we've been trying to do these every 2 weeks, the next one will be August 6th, where we will get together again and go over information with you, and again, checking in to see how things are going. And so please put this one on your agenda. And now that we have this new equipment in this room, and we actually have a link to Zoom, we might try to do something a little bit differently next time if it works on this system. So we'll see. Just make sure that you put this date down on your calendar. All right. So we wanted to make sure that we got you some information that was published by the Illinois State Board of Education, and when it was concerning the Early Childhood Block Grant, they put out a series of FAQs, and this is really pending from us now being in phase 4, and wanting to make sure that people understand as Illinois schools and early childhood programs start to open, that there's been a lot of questions, and they wanted to go ahead and provide some responses to it. So we will make sure that it gets to you. Some of the things I wound up pulling out, I just thought that it was worth mentioning. And really, we've kind of covered some of these things, right? But what ISB is saying is for their early childhood block grant, they want to make sure the programs who are receiving the funding that we're requiring the use of appropriate PPE, and that includes the face coverings. And they also specifically mention in the FAQ that face shields are not a replacement for face coverings. And so I wanted to make sure that we reiterated that. I know we talked about it at our last EDPD meeting. Also requiring social distancing be observed to the extent possible. We know with our young learners, especially infants and toddlers, that may be a little bit more difficult to do. So to the extent possible, they are asking and requiring social distancing to be observed as much as possible. They're also requiring symptom screenings and temperature checks. And what they're saying is, or
right? If you can't do those, then require that individual self-certify that they are symptom-free before entering the school or center. So this is interesting because I know we hadn't really talked about self-certifications, and our guidance really has been geared towards making sure that you're doing those well-being checks upon arrival.
Absolutely.
And we still want to make sure that you're holding yourself to that, but we just want you to understand what ISB is saying. It could be an or, but for us, we want to make sure that those screenings are done, those temperature checks are done upon entering the building. They're also saying that they want to require an increase in cleaning and disinfectant. You know, we've talked about that quite a bit, so that's no surprise. Enhanced cleaning that Lorenzo has talked about, the fact that we want to remove those items, we want to remove like large items out of the room that are just bulky. You know, we want to give room, right, for that social distancing to occur, and we want to give room to make sure that the items that are in the classroom can be cleaned, and that's why Lorenzo had mentioned those soft plush toys. This isn't the time to have those types of items, and they really should be removed from the environment. In addition to that, one of the questions I wanted to kind of pull out of the FAQ, and you guys will get a copy of this, but it talked about how we prioritize enrollment when we're dealing with reduced class sizes. And I wanted to make sure that you kind of got this information that is published. And they're saying these are the things that they want us to look at when we're prioritizing enrollment. They feel that we should give priority here. And so going through the list, so children with IEPs, they want to make sure that we're giving preference. Children who are experiencing homelessness. Youth in care. And so youth in care, of course, are programs for children and young people who need to be cared for away from their own families for a variety of different reasons. And so not quite foster care, but maybe they've been removed from their own family. And then children with a family income that is 50% below the federal poverty line, poverty level. And so children whose parents or caregiver speaks a language other than English. So are English as a second language learners. Children whose screening indicates a delay in development, but do not have a current referral yet. Also, children of families affected by COVID-19, the pandemic. And so this is interesting, right? Because, you know, they want to make sure that, you know, we have some communities that have been hit pretty hard by COVID-19, and we're recognizing that as you look through the data in our various communities through CDPH, they're calling this one out. And so I just want to make sure that you guys are aware of what ISB is saying regarding our PFA and PI classrooms.
So one of the things, and I'm just going to chime in real quick before we move to the next one on Spotlight, going back to ISBE, and this was a question that was posed before, whether or not ISBE was allowing for remote learning. And in this FAQ, once you get it, you will see that they're saying the exact same thing that we've been saying, is that, you know, if a family is not in your center-based care, that you need to have established your method for providing remote learning, that understanding that there is reduced program numbers, and so students receiving remote instruction count towards your attendance. I just want to read that sentence for you. That was a question that has been posed about the block grant before, and I just want to make sure that we have and take the opportunity to say that out loud. Again, students receiving remote instruction count towards attendance under ECBG, and I know that was a big one. We were hoping that we would get that word from them, and we now have it in writing. And again, to Tiffany's point, it's going to come out so you have it in your hands as well.
Absolutely. Thank you so much, Lorenzo. So one of the things that we've done, this will be our third week of doing a Children's Services Division Spotlight. Our first week, we wind up issuing the Spotlight. We put the spotlight, so to speak, on Chicago Commons. And then last week, we wind up putting the spotlight on El Valor. And one of the things I want you to know is that we know that you guys are doing some incredible, amazing work. And we want to be able to showcase you and we want to be able to make sure that the awesome, wonderful things that you're doing, that we also shine the light on you. So please forward your stories, your videos, any pictures. Tamara Martinez, her email is there. She is the person who's helping to be instrumental in pulling this information together. And so every week, we're going to get out a new spotlight, and we want to make sure that we hear from you, and we want to make sure that the story that you want to be told, that we're going to tell it, you know, in a very positive way. So Rachel and I, we received a lot of information from a lot of different programs. And, you know, and we want to make sure that you understand that it can be you too, that we go ahead and shine that light on, because we know that you're out here day in and day out, and you're doing an amazing job.
So again, just to make sure that everybody understands that we still have a travel order, and actually now there's more states that have been added. It's up to 18 states right now, surrounding states as well, in the South, and also, you know, of course, those on the West Coast and then Upper East. And so those states are on there. They are travel bans. Again, anyone traveling to those and they're there for, you know, 24 hours or more, they are required, or the individual is then required once they come back to quarantine and isolate themselves for 14 days. And I just need to remind everyone that that is still there, and the number of states has increased since our last meeting. Just want to make sure that everybody understands that it is still a mandate. We talked about you're working it through at your agency and how you communicate with your staff. It is time where people are wanting to take vacations, taking kids back to school and doing a lot of other things right now. There's travel that people have to do, just within your policies, your procedures, and your structures and guidelines. Just make sure you're keeping up with the travel order and the ban that is here in Chicago.
Yeah, and I just wanted to add that Rachel had mentioned other states, right? So this travel order went into effect by the Chicago Department of Public Health and Dr. Arwady on July the 6th. But as Rachel mentioned, they've added more states. So it really does behoove you to make sure that you're checking out the website to go ahead and make sure that you know kind of what the latest and, you know, greatest information is. They update the list every Friday. And so they've already forecasted effective July 24th, there's another state that has been added effective tomorrow. And so I want to make sure that, you know, you guys know that, you know, it's forever changing, and you definitely want to make sure that you're kind of keeping up with it. It is very fluid. Want to make sure that you are visiting chicago.gov /coronavirus. There's the latest information on there. Even when I mentioned the travel ban information, all of the latest information regarding COVID-19, our response to it, what we're doing here in Chicago can be found there. Some really good information. Please make sure that you're visiting it to get those latest things. Now we're going to go into the announcement and reminders portion. Before we get to questions, I got a few things. But one of the things I wanted to mention is that we worked to go ahead and put together some education kits that are going to be sent out to every child in the program. This is for home-based programs, this is for center-based programs, family child care homes. So every single child 0 to 3, every single child 3 to 5, they will be getting educational kits. And so the address that's associated with each of your sites will be receiving a shipment. We'll be receiving a shipment. We're actually going to start, the shipment is coming from Lakeshore, the kit, and the shipments are going to start July 24th with an expectation of arrival the week of August 3rd. So wanted to make sure that you guys were aware. And these kits are really, because we understand that remote learning may take place, you know, even longer than what, you know, than what we would actually want to have happen. I think people are, you know, they want to go ahead and get into programs, and they want to go ahead and kind of return to normal. But we know that, you know, a part of what we're going through now, it may be extended, and we want to make sure that we give families some tangible items that they can work with as they're working with you on e-learning platforms and remote learning, and helping their children kind of work through some of those small motor skills and other things. So these kits, they're going to be important, and August 3rd, the week of August 3rd is the arrival date. So make sure you communicate with your staff to know that there's a shipment coming. And we've accounted for all of the children that we have enrolled in the program. In addition to that, our ECBG, PSA, and PI, the fiscal year ended June 30th. Yay for another successful year. We need your help in making sure that you're submitting and wrapping up your final vouchers. We have a deadline in which we have to report to Chicago Public Schools, and we're needing your help to go ahead and finalize those vouchers. So it's very important that you go ahead and make sure that you're working with your finance team to make sure that you guys don't miss the deadline. Missing the deadline could mean not receiving the funding, and we wouldn't want anybody to be in that type of situation. So it is dire that you go ahead and you get your vouchers submitted. If there's any delays, if there's anything that I should know about your inability to do this, please send me an email, communicate with me, and let me know what's going on, what's your situation. I'd love to hear from you in and around it, because we really want to make sure that we go ahead and account for all of our dollars. In addition to that, we want to make sure that these funds that we're allotted, that they're being utilized. You know, we have over $80 million that we received from ECBG funding. And when I look at our expenditure rate is pretty low, okay? And I'm saying that so everybody can hear me, because, we want to make sure that these funds are utilized. And the only way we know if they're utilized is if you voucher. And so I need you to go ahead and submit those vouchers. In addition to that, because we've started a new fiscal year under our PSA and PI, the fiscal year started July 1. And so now we're in FY 21. So contracts have went out. Need to make sure that that you guys are being responsive and getting all the paperwork that's needed to make sure that we can go ahead and approve your contract. So thank you for your help in doing that. So just make sure that you're communicating with your finance department in and around those budgets, and your program staff in and around those scopes and so forth. So that's my updates for PFA. Our FY21 Head Start grant applications, we have sent those out as well via email to all of you who are federally funded. And so we want to make sure that you're being responsive to those. If you have any questions, definitely let us know. And we've already been getting some questions and, some back and forth. So I appreciate you guys for being responsive to those grant applications as well. But just wanted to put that reminder out. The next reminder is around the census 2020. And so just wanted to encourage you to encourage your families. If it's newsletters that you send out, if it's something, however you communicate with your families, what we're asking is that we need your help with making this relevant, right? We get data according to ward information, and some of our wards are performing better than others. Some of them may need a little nudge. And I don't know if you saw our mayor, our amazing mayor on the news, but she talked about the cowboy who's going to be going through some of the wards, And the cowboy, if you see the cowboy in the neighborhood, that's not a good thing, by the way. They're only going through the neighborhoods where the response rates are low, right? And so what I'm going to say is, can we all be our own cowgirls and cowboys and make sure that we're communicating with our families about the importance of responding to the census, and especially with our most vulnerable families, and making sure that our immigrant families and, everyone, right, we need to count everyone, because this is how we get funding to the city. Enumerators will start to go out next month. And so that's going to be important too, for you to know that they're going to finally be out in the communities counting. And so self-reporting is definitely a way to go ahead and get those numbers firmed up, but we will have enumerators out there starting in August. Next announcement, just wanted to let everyone know that we do have requests for proposals that have been kind of staggered, that are going out. And so they can be found on the city's website. If anybody are interested in open proposals that the city of Chicago, including our department, has that are advertised, you can see those on the city's website, on the procurement website. So please take a look at that. We welcome you to do that and kind of see what opportunities are available there. But just so you know, what we've done in the department is in children's services, all of our support service contracts, we have RFP'd everything, right? Everything that was in a RFP, everything that was in a support contract, we have RFP'd. And so we have, we're issuing a total of, I believe it's 9 RFPs total, but, you know, things like education services, disability services, health services, family and community engagement, dental services, so, and some others. And so I just wanted to let you guys know that those things are up for competition, full and open competition, and we're excited, you know, to be able to, you know, get these out here and get the responses, and just wanted to let you know.
Thanks, Tiffany. So we can go ahead, let's see what kind of questions we have, Tom.
Linda said, I saw that COPA has a feature for attending children in remote learning. When should we use that feature? So what we were wanting to do, Linda, you're right, they do have that feature. We're working with COPA, and when we had mentioned earlier that we had to get to placement first, Craig is going to actually be working with COPA so we can put together some tutorials. We don't want you guys to just kind of go out here and start, you know, kind of doing your own thing. We really do want this to be a guided approach. And so Craig is going to start working with COPA on making sure that we can put together tutorials and demonstrations for you guys on how this is going to work, okay? So just hold tight a little bit as we go ahead and kind of get that information together. That way we're giving you something that's going to be palatable and not having people just kind of do their own thing.
So Scott, I see your question. What percentage of children are participating at sites, and then how many are attending remotely? We're trying to capture that. That's why I'm asking again for this information, because it hasn't been coming through consistently. And so that's my ask again today is for that reason, is to make sure that we're getting the accounting of the children that are in buildings and also the children that are being served remotely and in their homes, so that we can then get to our enrollment numbers. And as I said today, ISBE is now allowing also for remote learning to be counted as attendance. So both of our major funding sources are allowing for it, and we're going to be doing our due diligence and working with all of you and making sure that we're capturing our numbers.
And Scott, your next question is regarding the temperature checks and retroactive. So no, we actually don't want them to be retroactive. So even when we wind up setting this up, we don't want you to have the ability really to go back into the past and try and put temperature checks. The whole purpose really of doing the temperature checks is the fact that you're doing it right there on the spot and you're making those decisions in the immediate, right, in the immediate time frame to say either yes, they can be admitted to the building or no, they can't. And so we don't want that to be something that people are kind of trying to play catch up on. And so we will not be asking for you to go back retroactively. What we are asking though, and you know, if you're already doing temperature checks, I guess my question to you is, how are you capturing that information? Are you putting it in a spreadsheet? What are you doing in the meantime now that the data system isn't up and running yet? And so, you know, you can let us know.
And so can we share the documentation that went to parents about enrolling at CBOs? I'm making the assumption, Scott, what you're asking for is what information is going out to parents through the application system. I'm not sure if that's what you're referring to. If you could clarify that for me, that would be helpful, and then I can maybe have a better response to you on exactly what you're asking. I can make the assumption it has to do with what went out in the system, but I want to make sure and verify before we actually answer that.
Yeah, and I think that's a good point. So we do have copies that we can share with you guys, the offer letter that one will receive, right? We can definitely give you a copy of the offer letter and also our wait list letter as well.
Right.
And so if that's what you're referring to, Scott, you can just go ahead and confirm, and we can definitely do that. We can do that for everyone, actually. We can put it in the next CSC update.
Absolutely. And so when it comes to our webinars, once we're done, they go up onto our YouTube site, and you're able to access the PowerPoint. You're able to access the information on our website, the YouTube site, after we do this, then Tom takes care of it. He gets it done, he gets it ready, and then it gets uploaded to YouTube so that you get access to that. We already talked a little bit about Walgreens.
The CSD update.
CSD update.
Yes, that's
It'll
how
go,
yeah.
and it goes out in the CSD update, I apologize. And so you will have it, it will go out in the update.
And so thank you for letting us know. We had mentioned earlier about the Walgreens, and I'm glad to know that they have a one-day return for the results. That's pretty good. I know Eva had mentioned about some results coming in. It was a rapid test where you can get within 15 minutes. Wow. Wow. In one case, she said, but yeah, a lot of the results came in a couple days, but there was one case where there was results in 15 minutes.
Right.
Wow.
In some of the clinics and doctor's office, they have the rapid response. I know because I had to get one. There's not, yeah, and it came back within 20 minutes. And so it's a great thing when you're able to get it as quickly. But one of the things that we're concerned about is if it's an elongated period of time that you're waiting and not knowing what to do, especially when you're operating your businesses. We just want to make sure that we have access in community where we can do it a little bit more rapid than that.
And Julie had mentioned that she wouldn't suggest CVS or Walgreens because they have you actually do your own nose swab. And how difficult the nose swab may, and uncomfortable that it may be. And so thank you, Julie, for letting us know. I haven't been to that location.
Right.
I think that it's an option for those who need that option, you know, and so, but thank you for letting us know.
Yeah. Are we to report positive cases that existed before the agency reopened or just after? I would like to know any that you're getting reported, even if you haven't opened up your doors yet, just so that we know and we can record that it happened in that particular community. Is helping us keeping accounting of what's going on. So for me, it would be both, even before you reopen, if you have not reopened, and definitely when you're open, continue. And well, let's hope that there are no positives, but if you do, yes, you would be required to report those. I'm going to read it out loud. Our center has developed a 2-layer introduction and information to inquiring families. And we have designed a simple flyer for first introduction. After more interest, we delivered a PowerPoint to send to families. If there's further interest, we will set up a video meeting followed by enrollment forms being completed. And so it sounds like you're using that as your enrollment process for bringing in new families. I just want to remind everyone that your current enrollment are the families that you had enrolled pre-COVID, and wanting to make sure that we've engaged all of those families. I know some of those families may have said they're not coming back, and then you're doing enrollment for new families, and that's fine. But just remember that we captured your enrollment pre-COVID, and those are families that are still resting in the COPA data system. Tanika, thank you. If they're not picked up, you'll gladly take them, I'm sure.
She's talking about the child size mask, you guys.
Okay.
Don't come get them.
Absolutely.
Tanika, we got you.
All right, so just remember, we need them picked up because we have to report back to where we got the donation from, that we've had a successful delivery to everyone, and that these are out and children have them. And I haven't been able to report that yet because I still have some here at the site. What's the guidance for the conflicting? Do we know CDC or do we follow IDPH? I'm thinking that's what you're asking me. I always say go to the highest and the strictest guidelines. If they're telling you, for example, if somebody says you don't have to close, but you're getting medical guidance that because of what you reported, the recommendation is you close. As you close your door, you clean your facility and make sure. Because if you don't and something happens, then you've had guidance that did direct you to close, but you made a decision to not. And so just be very, very careful on how you're making those decisions. We've not been told to pick up. If you are, let me put it this way, if you're a partner under a delegate, the delegate has been picking them up and should be distributing them. We gave them a note that said how many are to go out to each. And so we were giving those to delegates who then had responsibility for making sure that their partners actually got their mask. So if you don't get, and there's a follow-up, please let us know and we can talk to make sure that we know what may have happened in your specific case regarding the mask. Ken is asking, will ECBG allow you to be paid for for PFA or PI families if you are serving them virtually or remotely. Yes, that's why it's included in the FAQ as guidance. I could not sit and say yes to it until I got the guidance. I can say today, yes. It counts towards attendance, it counts towards enrollment, and so the answer to that question, Ken, is yes. Yes, to clarify, ECBG will now cover remote learning, yes, but that does not, ECBG and CCAP are two totally different funding streams. The Child Care Assistance Program will not allow us to document remote learning. The only two right now that we have this guidance from would be Head Start and now ECBG or the block grant. They are not allowing it for CCAP.
Correct.
Okay.
Will the Lakeshore Kids also be distributed to home visiting programs? Yes, Constance, every child. So what we've done is we provided the address to the cluster of the home visiting program. And so we provided them an address to go ahead and send it to. Then it's up for the program to go ahead and make sure that you're distributing them to your family. But it includes our home visiting programs, family child care homes, and center-based. So everyone.
So Scott's question, are they going directly to partner sites or to the delegate to be delivered to the partners?
They're gonna go, I've asked for them to deliver to every site, Scott. That way it can make your life a lot easier. I know that you have a lot of, you have a lot of directly operated as well as partners. And so the message that you send to your staff to be looking out for the shipment to come to their site.
So the other question that he also has, support service contracts, when Tiffany talked about going to the website, yes, our support service RFPs, those that have been completed are on the website, and her point is there's some others that are still being finalized, but they will also go up. So continue to go to the website and see the notices that are out there for support service contracts. And yes, next, Zuli is saying you saw the feds put out a notice of RFP for early Head Start City of Chicago, and it says it says that they are anticipating maybe 24 awards. That's absolutely true. What does this mean for delegates for DFSS? What that means is we, Department of Family and Support Services, City of Chicago, are writing a competitive grant for our Head Start, Early Head Start CCP. As a result of some of the deficiencies on the grant from child harm and incidents that have occurred at sites where children were either harmed, there was a corporal punishment, those kinds of things are non-negotiable, and those are the kinds of things that sends RFPs into recompete. And as a result of that, you have seen that. That was the last thing that I was going to say, but because I see this here, I'm responding to it now. So yes, it is there. It is the notice of award, the forecast is on the system. They have not opened up the grant application. It is the forecast that is open, and there's other information that you are definitely able to see on grants.gov. And so again, we as an organization are, as anyone would, we are applying for our funding, and we will be submitting a competitive grant for Head Start, Early Head Start CCP. What's the guidance on food experience in the classroom? My guidance for you on anything that you're doing where you are working, where more than one person is touching anything, especially now, it is not something that is definitely recommended. If you're doing a food experience where you are individualizing, where each child has their own, that there's no combined anything, and again, you have to think all the way through, how do you do this so that there's no sharing of the food, there's no touching of the same utensil, there's no passing of the bowl. And I'm trying to think of everything that we would do in a food experience or that I've done, and I'm basically saying no to all of those things. It makes it really, really hard to do it in this environment, and it's not something that we recommend. Just as we're saying, even your meal service has to be individually plated to minimize risk. It's something that we're not necessarily advising that you do at this time. Are we forward-looking, anticipating the impact that if CPS revises the hybrid model and only does remote learning, are we looking at how this will impact the perception of families? We are looking forward. We're trying to keep our fingers and our hands on decisions that are being made regarding schools reopening. We also understand, and I mentioned it in our last EDPD, that we are open and we're providing a service for childcare that, based on where we are with COVID-19, has allowed us to reopen in phase 3, 4. CPS is looking now at what it might be able to do in the fall. CPS has much larger class sizes and group sizes than we do in our classrooms, and they're having to really think about what they might be able to do within their buildings and within their structures. Not just Chicago, but nationally, it's an issue with them trying to figure out how do we reopen. One of the things that we're looking at here is, if schools don't reopen fully, and I said it before, I'll say it again, I know many agencies have followed the CPS model, but we're doing something different. We're living in a different world right now. And I know that it's going to be some parent perception. And what I want to lean on with all of you, and I've said it before, is our ability to make sure that our parents understand that you're licensed child care facilities and that you have very strict health and safety guidelines and protocols that you've put in place that have allowed you to open up your classrooms and your programs and provide health and safety safe environments for children and families. And we have to continue to say that. We have to show that we've been able to open and operate even in this climate and with everything going on, to try to allay some of the fears from our families. Those perceptions are going to be there, Scott, but we have to do our work on our side to really get the message out there and very clear and concisely about everything that you're doing in your facilities that's protecting yourself, your children, and your family. The offer letter, yes, we'll make sure that you get the offer letter so that you can see what language is in that. Scott, thanks for clarifying that.
So there's a comment that students and staff are tested, but they aren't given documentation saying that they're negative. So what do we do?
I will ask that question when I'm in the meeting about what people might be receiving and what the message is saying. So thanks for bringing that one up. I will take that to CDPH. Thank you. This says, are we allowed to ask families to take their children to be tested before starting school?
So we talked about this before. We talked about this, right? As a preventive measure, is that going to be kind of the best practice? And we don't believe that it is, because a test is kind of it's like a time and place test, right? Just as quickly as you go get tested, anything that you've done, any type of behavior or places that you've been, you could have came into contact after you've had that test. So getting a test and having to go ahead and submit results upon entry, especially kind of hearing some of our partners here talk about 7 to 10 days to even receive results, is that really going to be the most effective thing? In accordance to the rules from CDPH and IDPH, they're not recommending that, and so we aren't either.
Is there a resource that tells us when a child who has had a symptom such as a sore throat can return to school? It's the combination of those different ailments or things that parents or children have, and I would say go to the website as Tiffany has recommended, City of Chicago Coronavirus CDPH, and it talks you through some of that information. Again, we're not the medical professionals, and I don't want to speak out of turn, and I guide everyone back to the resources because they're working with CDC and others to give us the guidance that we need. So I recommend that you go to those websites.
There's a question, Julie, thank you, about suggestions on giving in-person tours to interested families. I think that one of the things I would want you to consider, if you're going to even think about this, is doing Saturday open houses or something like that, but not have them open by appointment only, where you're able to go ahead and kind of socially distance, kind of walk a family around your facility in a safe fashion. And then you can make sure that you're doing your enhanced cleanings before and after. that would be my recommendation. As far as bringing them in while children are actually there, I'm not really sure if we want to support that, but we're going to go ahead and see if there's any Q&A that's going to be available for us, Julie, so that we can give you kind of what our funders are saying about that, okay? Because I think that's a very important question. It is a part of what we do to kind of recruit new families, and so, let's try and figure out a way that we can do it, but also keeping the children that we have enrolled and the staff that we have enrolled, right, safe. So hopefully maybe a Saturday option, could be an option for you, but we will follow up with you, regarding if there's any other kind of advice that we can give.
Christina, I see your question is about physical signatures, and I will say I know one of our funders, or one of the funders, CCAP, is requiring physical signatures, and for that reason, what we're saying is this needs to be something that we're able to do, and internally have to figure out a way to make sure that children are signed in and signed out. We have to know that the child came in with an authorized adult and left with an authorized adult, and we can't move from that. That is still something that's being asked of us, and that makes a responsibility for you. DFSS has indicated it will be seeking a waiver for in-kind. Are you also seeking a waiver for disabilities? Right now, I haven't had a need to seek a waiver for disabilities because we were on schedule and on target for meeting our 10%. So we haven't had to do that, and it's the overall, not delegate by delegate, but looking at the overall, we were okay. So that's why I'm trying to get capturing the enrollment now, so that I can see the children that are currently being served, so we can go back and look at our numbers one more time, Scott. But what we're wanting to do is make sure that if there's a waiver that we need, I need to have this data in order to request it if the number of children have fallen and my numbers are off. And that's why I'm asking for the assistance on your side.
There is a question about if a parent, not the child, but the parent, this is a state that is on the travel order, is the child allowed to return to the center?
We kind of had that one the last time we had our EDPD, and the child is in the hands of the parent, who is the person who went out of town. And so being that they are in the same environment, the parent and the child, I believe, would be possibly impacted by having traveled, and therefore they should both be quarantined. Head Start early and Head Start expansion opportunities were posted on grants.gov today. Is DFSS writing for the early Head Start expansion opportunity? I don't have an answer for that today.
Scott, look, look, you know what? We're going to go ahead and apply for everything that we can. Let me just say that. but we'll see. We'll see.
We're looking at it and making some decisions on what our next steps on many of these things are. And it really is based on our current status and enrollment and those things. And that's why your information is so vitally important for us. Do you know if there's a will not still pay if they remain remote? I will say that this guidance is new guidance as of yesterday, and it being just updated right now. What we're saying is moving into fall. They were putting guidance together that takes us into the fall, and so if once you get this, if you look and you read in here, it talks about fall and other things as well in this guidance that you will receive, and I think it will answer some of your questions. But as far as them paying, they've given us the ability now to look at both your center-based enrollment and also your remote as a part of our counting your number, which is new guidance that we've received, and it allows us to still pay you as you're vouchering for your services. A question about, can ASQ online instead of paper forms be made available? We can look into that. One of our issues with the online, let me put it this way, we had some issues with the online, and so we will look at it again. Right now, we are still doing paper. Again, I know we would like everything to be online, and we're looking at everything that we need to do, and that might be one of those that we want to move forward with. But again, we will have to look at that one more time because everybody didn't have the same access and ability to do it, and that kind of makes it very, very limiting. And we can't have anything that can be done one way and not another. It has to be a way that we can do it 100% across the board.
We're happy to see this comment. It says, thank you for all the We Are Open banners. Yay! The reopening of our site is going very well. The children are doing well, and our remote learning has been a challenge for some families that have not reached out due to their return to work or the inability to get technology due to technology deficiencies.
Mm-hmm.
Thank you, Monique.
Thank you, Monique.
Appreciate you for providing that comment, and we're glad that the We Are Open banners are working for you and your site.
Couldn't food experience be done as a teacher demonstration and children can help discuss? Absolutely. Again, I said, my point is nothing shared, nothing touched by two. And so however you can do it, where you can minimize all of that and have children see you do some things, even, you can do that even with a Zoom as a remote activity so that the children and families can see you do it. There's many ways to do it. It's just, again, I listed all those things that you should be thinking about. How can I do this without sharing a utensil? How can I do this without two children touching the same bowl? As long as you're able to think about it and do it that way, then yes, of course, we can do some demonstrations. And then you can discuss it and go back and forth with questions and answers with your children. Absolutely.
Zuli had mentioned that ISB had just sent out guidance that stated that funding and slot allocations will not be decreased in FY21.
Yep.
So, yep, we got flat funding, and so that is also, like we're happy about that as well. We're happy to be able to report that we did not get a decrease in funding for FY21, and we understand that that probably was a heavy lift for the state, and so we are appreciative for the governor's office and keeping our funding level.
So someone commented that usually the doctor sends out an email with results, which again, based on what's in the results, is it negative? Is it positive? Exactly what does it state after the test results? Meal service. Do all plates have to be plated right from the kitchen, or can teachers plate the children in the classroom once you're doing meal service? You can do it in the classroom with gloves, with PPE, and making sure that you have individual plates that you're able to actually put in front of children. But you have to be very, very careful in doing it. It can be done that way, yes. But again, you have to be very careful. Teachers have to understand. And right now, and I know one of the things with ISBE before was about making sure that children got the exact portion of a meal, and that's why we were doing family style. But right now, we're not doing family style, and it's making sure that children are able to get their individual plates, that they're not sharing serving bowls, and that we're not doing family style is what we're leaning on. And for home visiting, again, for home visiting, we understand that you're not seeing the families, you're seeing them virtual. And so, no, you're not going to have signatures, you're not going to have those kinds of things. But what you have to do is document the time that you begin, the time that you end, and who did you see and what did you cover. If you're able to do that, then that's documentation that we'll take for a home visit. Following up on Zuli's question about the forecasted, I found this announcement extremely disconcerting given Office of Head Start can award up to 24 grants. As an organizational leader, dependent upon outcomes, it's possible that we could see another round of defunding in the third or fourth quarter of next year. I only hope the city leadership will manage our expectations and not follow New York City or Los Angeles, as delegate agencies report that relationships severely soured the closer they got to the date of the grant award. Let's be different in Chicago and discuss this issue with full transparency so that we can all start planning accordingly. So what I'm going to say to you, Scott, is this is a competitive grant that we're marching into. It is competitive. It is forecasted. Yes, in the forecast, it said that they would, based on the amount that's out there, which is larger than our current grant that you see on the website, what they're saying is that they could grant 24. One of the things that I think we all rest with is that we are writing something that we've not done before. It's an opportunity in the city of Chicago for us to rethink everything that we do with respect to all of you, absolutely. And thinking about how do we write the strongest grant we possibly can so that we can keep the funding here in our house, and that's the direction that we're going. And are we thinking about who we serve and who we are in service of? Absolutely, as we're marching down this road. Again, it is a competitive grant that we're writing, and just as you sat in a seat a year ago and writing a competitive grant for yours, now the DFSS CSD team is sitting in that same seat and readying itself to do a competitive grant for our current funding.
If we survey our families and the majority want to stay remote, can we do that in the fall and still remain fully funded by DFSS for PSA, PI, Early Head Start, and Head Start?
So I will say that as we get guidance, and guidance is time limited for Head Start right now, it's only through September. As things change, each time things change, if this, COVID is still, rising and our funders say we can continue, we will give you that guidance once we get it. But we can't give you any assurance that it's going to go past any of the dates that's been given to us. And the flexibility for Head Start only goes through September 30th. If we get new guidance that takes us beyond that, when we will be able to continue to do that, and we're staying in touch with them and trying to make sure that we're getting it as quickly as we can so that you know. But again, realize everything we're getting has a beginning. But there's going to be some point in time in the future where the flexibility will no longer.
There was a great suggestion too about the virtual tours and Zooms, which are great recommendations. Isn't a big, and so we have to make sure that we're going to be prepared for those that have the technology. How are we adjusting our strategy to screenings, EDR, remote, complete 45-day screenings?
We're going to come back to you on all of the 45, 30-day requirements so that we are able to better help you understand how we need to do some of this. We also have a mandate for hearing and vision that we're working on as well. And so we're working on all of those, and we will get those to you.
Absolutely. Scott, I recognize the gravity of COVID-19 issues and the reason why we continually focus our EDPD meetings in this manner, but when will we focus on our global program outcomes, what we are doing well, what needs improvement, where we are failing, I'm assuming that means. I'm not talking about individual agencies. I'm focused on, are we winning collectively as CBOs in the city of Chicago?
And so, Scott, to your point, yes, we are going to pivot. We are where we are because we have not gotten all of our centers open. And I have to continue to stress those things, and I still have to because we do have some positive cases. Those are the things that I have to stress. We are going to pivot and start talking about where we're moving forward. We're going back to our logic model. We're going back to our outcomes that we set out in our RFP, and we will talk about where we are. We know that we've had roundtables with our delegates, and we have those action plans and some other information that we're pulling together. And so, yes, we will be pivoting to this as we talk about what it is we have as outcomes and where we plan to go over this next year. I have a staff person. Monique, I see your question that you have a staff person that has a young adult child that will return from California back home this weekend. I'm going to give you a recommendation, and that is that you actually call CDC, CDPH, and ask for guidance to make sure that you're following up with what you need to do. Because again, if the person is in the environment, and it could be much bigger than we can put in this particular question, but I would ask you to just reach out and say this is what's happening and what guidance they might give you as far as what you need to do with your staff person. And food experiences are great ways to share and family connections. Send things home for families to do together. Great, thank you. Thanks for sharing that.
Cindy, are you inquiring about the funds for COVID PPE? Did they get released yet? So let me just explain. So we received a funding opportunity. Our funding opportunity is something that we had to apply for, which we've done. We submitted our application to get those funds from our funder, which is HHS. We have not received an award letter yet on those funds. And so to answer your question, it's no, we haven't released any money because we don't have the money. And so we were early, trying to be on top of letting you know that this is coming. We do expect to get the money, but this is kind of premature for us to talk about a release date just because we haven't even received the notice of award from our funder. I hope that helps. Will the We Are Open banners be delivered to all centers, or do we need to order those individually? So Don, if you did not complete the survey where you requested to get those items, that window of opportunity definitely has passed. So those who have received them, they should have received them by now already. These are items that we shipped out to those who requested. And so not everybody requested to have We Are Open banners. But if you feel like you completed the survey and you want to follow up with me, feel free to send me an email and I'll take a look at my list to see if you were on the list and see where your banner.
And so Cindy, your question is, can you go ahead and purchase? Absolutely. As Tiffany mentioned the last time we were together, you can go back to any of your purchases, going back to earlier. For example, we closed in March. So, if you were spending money for PPE supplies then, once you have your money, this will reimburse you for expenses that you've already made regarding COVID-19 needs. And so, yes, you can go ahead. If you have the ability to go ahead and make those purchases, we recommend that you do that now so that you have them on hand.
Lauren, you can send me an email. Again, I don't have my list in front of me in terms of who requested banners. I'd be more than happy to follow up with anyone who said that they requested banners, and you too, Cindy. If you requested banners and you haven't received them, feel free to send me an email and I will follow up with you individually, because I don't have the list in front of me to confirm that. Yep.
So those were the end of the questions. We want to thank you. We have a few minutes. I don't know if anyone wants to share. If anybody has something that they would like to say out loud for others to hear regarding how things are going out there, we invite you now to go ahead. I just wanted to make sure that we address questions, which we've done before we move. But if there is anyone, this is an opportunity for you to let us know. Letting us know in the chat box, and we'll unmute you if you're interested.
Mona, yes, my email address is Tiffany, it's traditional spelling, Tiffany, dot, then it's Junkins, Junkins, at thecityofchicago.org. Can you type it in the chat? You're welcome, Mona. I think sometimes I take for granted that everybody doesn't necessarily know me. And Tom has put it in the chat so everyone can look and see my email address. So if you need to go ahead and do a little outreach regarding your banners, or if you have any other questions, feel free to send me an email.
Thanks, Cindy. No, Tiffany is missing out. There you go.
You're so sweet, Cindy. I mean, I thought everybody knew me, Cindy. I'm just saying.
So I know I've seen some comments, and I think those have put comments in there that said things are going well. Again, you know, yes, we're keeping up the fight out here, Cindy. Absolutely. Just want everyone to know that we're here. We will be reaching out if we don't have numbers from people, because we do need to for multiple reasons, one of which Scott mentioned, looking at our disability number, looking at our enrollment numbers. Need to know both your group of children at your center-based and also those that you're doing remote. Regardless whether you have federal funding or state funding now, you're able to do remote learning. But again, in order for us to be able to work with both of our funders, I need to capture the numbers. So I need both the number of classrooms, ages of children, number of groups, how many children are being served center-based, and also how many children are being served remote, so that we can capture the number for you, because you will want to be paid for both sides of that. In order for me to then have something in my house that I can work with the fiscal team, we really need to get these numbers so that there's no impact on your part for any of what we're doing here. So again, just make sure that we have the numbers and everything can be updated. And so again, to one of Scott's questions, and yes, we do need to pivot. We need to pivot to outcomes. When we were together in our meetings and we were able to be in the same space, we've started some of the conversations, and we're going to go back to that. Again, we have had roundtables that's given us some information here at DFSS. We're going to be building from that and moving forward as we plan for this next year. Right now, we all know we are still in the midst of COVID-19 here in July. We're moving into August in another week. And we know that we have cases rising all around us as far as our national status, even having an order in Chicago for travel bans. We know that things could change. We know that we could get to a point where we go backwards in the city of Chicago. I'm hoping not, that we will be able to continue to go forward. Having us had the mask mandate, having us do everything that we can, and you doing everything that you're doing every day, for those of you who are open, who are providing safe and healthy environments, we've been able to operate without massive cases of COVID in our centers. And I thank all of you for what you're doing, because that's why. But again, we are still looking at what's happening nationally. We're looking at what's happening in other states. We're looking at what's happening in counties around us as we're moving forward. And so we're hoping that our conversation is constantly forward moving, but we also have to rest in reality and say that we know over the next few months, information will be coming that will continue to guide us on what it is our next steps will be. And so, yes, we're going to be talking about COVID for a while. It's not going to go away, but we do have a lot of other things that we need to have on our agenda. And we're finding mechanisms and tools that will allow us to have not just me talking to a screen, but us being able to do more fluid conversations with you. And that's what we're trying to build out so that we can do some of the other work that we need to do together. You are, our community. We're here for you. And just at any point when you need anything from us, just don't for a moment hesitate. Reach out, let us know what you need in support of you. We can't do anything. DFSS can't do any of what it does without this great community of delegates and partners that we have out there. So I thank you for everything that you do every day. And please don't hesitate if you need us to let us know. So take care, stay safe, and make sure that every one of your families are reminded of just what all you've been doing with and for them to make sure that this is a working environment, it's safe and it's healthy, and it's okay to come home. With that, thank you and have a great day, everyone.